This is the ZMAR Podcast. Elite Benefits of America helps small and mid-sized companies with their health insurance programs. And now, your host, Butch ZMAR.
We're going to talk about being ripped off today. Ripped off in so many ways. People could relate to this. Even I've done some crazy stuff to save a few bucks. I've ordered stuff on Amazon only to find out that they had a price reduction, and going through their little chat, I tried to get them just to give me the refund, right? I just bought this 3 days ago. I got it in my hand, but the price reduced today, and I want the reduced price. And they're like, sorry, we don't honor price matching. So I've actually literally, on Amazon's expense, shipped the one product back and bought the other one to get a better price. Other cases, even, and I'm just speaking for myself, I'm sure other people have done this too, where I bought things from Amazon only to find out that Menards down the street actually had it for less. We become smarter consumers as we go along, and sometimes it could go so far the other way where we get calls that people are looking for better deals on health insurance. There's no better deal, right? It's an insurance risk that is put together based on lines of coverage, and each insurance company has a price to insure that. Can some insurance companies be less than others? Sure. It's the same thing that car mechanics could charge for different oil changes. Does that mean the quality is different? Maybe in some cases, but just because you pay more for an oil change doesn't mean that you're getting a better outcome. And healthcare is very much related to that. In fact, there's been studies that the higher the quality, the less the cost, because they're more efficient and they do things better, and they have higher ratings. I mean, the list goes on. But some people are looking for this better deal on the health insurance. They want it cheaper, right? It's not that you're buying something for less and getting the same thing. Usually you get less, right? So you call my office and say, I want to cut my premiums by $15,000 a year. Well, right from the get-go, if you want a 15-minute conversation, that's all you're willing to give me, you're going to lose coverage. That's it. Some of these brokers that deal with some of these employers out there, sometimes you walk in there and they're so busy and they're like, dude, you only got 10 minutes to go over this renewal. Well, that's why some brokers are like, well, you know what? Just raise your deductible. That's 10 minutes worth of work, and you'll lower your cost, and we'll see you next year, right? Because they're not willing to invest the time. There's time involved in a lot of this. And if you're expecting quick outcomes, then that's all you're going to get. That's the reality. If you're not willing to invest anything, and you're not willing to pay for the advice to get to that point, that's a concern. So I want to talk about a recent article. I know when we're recording this, it's in September. It'll probably be published in October. But on 9/11, Wall Street Journal came out with an article talking about generic drugs should be cheap, but insurers are charging thousands of dollars more on certain drugs. And this has been going on for a long time. There's actually some lawsuits based on claims in that matter that insurance companies are paying different rates based on the policy you have for the same exact service, same exact code. And so why? Obviously they're giving better deals somewhere else. But this particular one, we're just going to talk about drugs. The cash price is different, but they charge the health plans more. So it's almost like when you get a bigger purse, they're going to charge more. And in some cases, healthcare at the retail front, which is like doctor visits and whatnot, some facilities are, oh, no. If you pay cash, we're going to be charging you full price. That doctor visit is actually billed at $250. That's what we're billing. Not the discounted rate by the PPO because you don't have insurance. So what's the go-in rate? Is it $125 after the discount rate, or is it $250, right? Or I had a bill for 5 minutes in the doctor's office. Now, he was a specialist, and we needed guidance and direction for surgery, but 5 minutes, he said he couldn't help. He had to go to a specialist. It was a $450 visit, discounted to $150. So is that visit for 5 minutes worth $450, or is it $150, right? We really don't know, right? It's almost like that old commercial, at least from the 90s, where how many licks does it take to get to the center of a Tootsie Pop? The answer may vary depending on who it is, right? In some cases, some people would say, well, who cares what the price is? The insurance is paying for it, which is a huge problem. But a lot of employees out there, or even people that buy their own health insurance, they complain that when certain things aren't covered, and who cares if they're covering it. in some cases, spouses are like this. One is conscious of dollars and they're picking health plans based on dollars. And then you have a spouse that's not paying attention to the dollars and complaining that they can't get to certain doctors or they can't get to out of pocket, or they're paying too much at the claim time, whatever it might be. There's just more. But they're not looking at the big picture. And I'm not necessarily saying you should eliminate a bunch of doctors. In fact, I actually think doctor networks should be gone now. It's kind of like, why are we still dealing with petroleum and cars? Because there's too much money into it. So it's the same thing. There's too much money in networks. And so they don't want to open it up because then you take away control when you do that. And so on a different note, there's so many changes that have to be made in order to keep money conscious or whatever it might be. But some people are like, well, it's an unlimited credit card. You just present the nice blue, purple, yellow, green logo on the card down, and it's all taken care of, right? And for a long time, it probably was, right? A lot of union plans are still like that, where you just drop your card and things are taken care of, right? The good old days, right? It's gone. Even unions are having a hard time controlling the cost, but let alone trying to figure out how to not to pass too much onto their union members, right? It's just really tough. So, but the reality is you still pay for it. So it's not this unlimited credit card. You're going to pay for it at some point, right? Same thing with taxes, right? One thing that people apparently forget, and I'm just speaking out loud here, Congress passes bills, and it's $1 trillion, and they put it in a law, and they're like, we're going to finance this over a period of time. And people are like, yeah, that's great, right? But not to realize that they keep doing it, right? Eventually, you don't have money to pay the bill, right? Same thing with the health insurance. If we keep doing and acting like, insurance will take for it. Well, in this case, the insurance company's just passing it back on to premiums. Well, politicians do it in taxes. It's just there's more of us compared to a health plan that you might be in. And so you will see less of an impact over a period of time, but it will go up. Taxes will go up. Health insurance premiums will go up. And so collectively, we play or pay into a pool, which are paying out more expenses, which means they have to fill that hole. And then at the same time, people are expecting no increases, right? They get older, there's more expenses, but even if you come back and say, hey, look, you're 1 year older, and so the premium went up 10%, like they complain, well, why 10%, right? Like, why? Inflation's only 3%. We hear it all day long, right? It's just the reality. Well, then stop using your plan for miscellaneous stuff and start asking questions on the healthcare costs, because if it was your money, you would do that. The same thing goes with my example about purchasing from Amazon, finding out that it was cheaper and you ship it back, make them pay the money just so you can get a lower price. It's going to happen like that with healthcare before you know it, because people are going to say that's absurd. Why am I getting a $450 bill for a 5-minute visit? That should have been $150 from the beginning. Why are they even billing $450? That's my big question. So the same thing here is like, why are we billing more and expecting insurance company to pay for it and then complain when the increase is there? So you can't have your cake and eat it too. It's just the way the money works. And if you want less increase, then have America spend less, right? And we probably shouldn't spend less. We have great healthcare system. You can get access to healthcare. I'm not saying don't get your health checked out and getting things taken care of. I'm just saying, like, your maintenance on your car. You have a little bit older of a car, you might budget things that go a little longer. Sure, it's a car, it's not your human life, right? But still, you might ask more questions before you start putting the credit card down. And that's what we don't do when it comes to health insurance. But when it comes to drug costs in this article, they're talking about for the same exact drug, they're billing the insurance companies 3 times the actual cost of the drug. And one of those reasons is pharmacy benefit managers, or PBMs. And we never really had to worry about this in the past, but it's becoming bigger and bigger of an issue. And more employers are challenging the cost, so therefore we have to analyze this. And a lot of companies that you're currently with, those who are listening to this, they cannot break apart the health plan from the pharmacy benefit manager. And that's a problem. And I'll tell you why here in a little bit. And mostly because the branded carriers, they own their own pharmacy. But and it creates a conflict, right? Because Peter and Paul work for the same company, right? So you're not robbing Peter to pay Paul because it's all the same money, right? It filters up and they're making the same money. So it's just a big wash for them. And because it shows up as an expense on a line item, it justifies a premium increase because they spent the money for you. So even though PBMs, or these pharmacy benefit managers, still direct people towards the generic drugs, they're still determining their own price that they're going to pay, and so to their sister company on top of it, right? So it's almost like if your spouse needed $50, so you give them $50, it's not your money transferring to your spouse. In most cases, it's one of the same, because if one day you need the $50 back, then it's just part of that companionship. And so the pharmacy benefit manager with the insurance companies, ideally the same thing, but the only difference is it shows up as an expense and then it gets passed on. So who's thinking about your best interest? Is it the insurance company or is it you? All right. And the insurance company is definitely not on the same page as you. The PBMs have incentives to keep the price as high as possible. And this is coming from this article. There's data that supports it. And there's people probably listening to this saying there's absolutely no way. I'm telling you that there's no integrity when it comes to money at times, and especially in the pharmaceutical space. And I think it creates a problem because it passes down to the policyholder, increases premium. So this article actually gives some really good examples. So there's a drug, and I could mispronounce it, but Clevic. I'm not sure what it was for, but they compared it and said Cigna was charged $6,600 for per month to have this medication. CVS Health was charged more than $7,000, but yet United Healthcare can charge $218 for that drug. There was an MS therapy drug that they compared, and the cost through a Cuban pharmacy, again, mail order, third-party mail order all over the country. It's available, and if you need access to it, just call our office. It cost $54 a month. But if you compare that to what UHC paid, it was $1,200 for the $54. And the list goes on. So hopefully in the show notes, I'll include a link. It is a subscription website. I'm not sure if the article is open or not, but I'll include the link so that you could refer to the examples that are in there. And that's why and we're going to talk about upticks in self-funded plans, but self-funded plans allow you to look at the data more. You could see where that information's going. You could see the expense in there, and you could see what they're actually pricing those drugs at. And so you could actually go to another pharmacy benefit manager, if it's a true self-funded plan, that is, and say, okay, here's our top 3 drugs, and this is what we're spending. Wow, what does your plan look like? But even if you were able to do a self-funded plan on a small employer, it does have less of an impact. But if you could turn around and save $12,000 a year on an expense that's coming out of your healthcare fund, then that could be big for a small employer. Whereas if you had an employer that was 100 employees or 500 or 1,000 or 10,000, right, that 12,000 could be $1.2 million, right, in drug costs alone. And so you have to look at the data, because if you could find alternatives, and if anything at all you did was provide guidance, there's third-party companies that you could add to the self-funded plan that actually help your employees actually navigate this and actually give them sound advice to their nurses and doctors that help guide them through a process to find alternative medications, maybe alternative ways, maybe alternative doctors, second opinions, third opinions, just because doctors push meds a certain way because based on their current beliefs, and that's okay. I mean, everybody's got a personality and what they believe, and that goes with all walks of life and industries. But you just may need to get that second opinion, just to at least be aware of it. If you do all the homework and you find out that drug is still there, at least you know that's the drug that you need. Definitely helps you get more resources in there. By controlling that cost, though, it can make the difference between having a 3 to 5% increase compared to a 15% to 30% increase. And so it could really add up to the bottom line for any employer, whether it's a small employer or if you're considered a large employer, even over 10,000 employees. There's case studies after case studies, and there's even a recent article that talked about that even the federal health insurance program for a lot of federal employees out there, that they're getting bigger increases and no one's evaluating this. And there's a peer in my industry that's down in Texas, Josh Butler. He's a great guy. I haven't talked to him a whole lot, just small interactions, but he put a case study that they helped out a county in Texas somewhere, and they saved huge amount of money that they were able to redistribute back to other resources within inside the county. And what I'm talking about, I want to say it wasn't like $100,000 or something, or I want to say it was in the millions, right? And so if he could do it at micro level of a county, imagine what he could do for a city municipality that offers a health plan, let alone with the federal government, right? And so there's probably, in the federal government, there's probably trillions of dollars that could be redistributed back to federal programs without increasing taxes, or just give the taxpayers back their money, right? Like they passed these laws that are $1 trillion, and just imagine if they took $1 trillion and divided among all the taxpayers out there and give them a refund of their own money instead of giving it to nonprofits.
Listen up, Butch wants to give you your own Elite Benefits Playbook, and it's absolutely free. From business strategy to benefits strategy, every step from the start through implementation, account setup, and open enrollment, working through service requests and the process of renewals. A valuable look at your company, your insurance options, and how to make the process easier on you. Go now to elitebenefits.net/playbook and get your free Elite Benefits Playbook, or give Butch a call today, 708-535-3006.
2023, we're over halfway through it, but there was an article that was put out on by a journalist on Substack, Wendall Potter. I have no connection with him, but I'm giving him credit for the data. He compiled it. I do know that I seen these resources that he had referenced in his article, and I encourage you to go read it. And they're from third party, even industry ones. He did a good job putting the data together, and I'm just using some references from his article. But the credit goes back to him by putting it together. I definitely encourage to go check it out. And so it's titled 7 Big Health Insurance Companies Pulled in $683 billion in revenue so far for the first half of the year, largely through taxpayer-funded programs such as Medicaid, Medicare, Obamacare with the taxpayer subsidies, as well as the pharmacy supply chain. And so I just got done talking about these are 2 different articles, 2 different publications, but the pharmacy supply chain is huge, let alone taking taxpayer dollars to help fund it, and the insurance companies are profiting more. But somehow Obamacare was trying to crack the whip on everything, and they clearly didn't control the cost. They actually gave it a highway to actually increase the profits for the entire healthcare supply chain, including providers, insurance companies, the pharmaceutical world, you name it. And then indirectly made it worse for the consumer. And I'll argue that any day, even though people say, well, it was good. Yeah, there was some good, but not at the cost that it was there. There was better ways to do it, at least from my perspective. You could have done it a lot more efficient, and employers would be paying lower premiums, as well as the individuals that are private pays. So get this, 2/3 of $1 trillion was made between 7 insurance companies. Get that, right? Like 2/3 of $1 trillion was by 7 insurance companies. I had to repeat that. It's crazy. It's mind-boggling that they're controlling the entire space and they're profiting more. Profits are up 8.1% compared to the same time last year, even though revenues are up at 11%. While investors are shifting billions of dollars, the article references during the first 8 months, as a consequence, their stock has lowered, right? So Wall Street's not happy with them, but somehow the money is still going in the bank. And our premiums are going up on top of it. Just give you an example, even stock, UHC stock was down 7.9%, Cigna was down 13.2%, and Humana was down 7.6%. Those who are listening to some of that could have been for Humana because they're exiting the employer market. They're going to be focused on the Medicare and possibly Medicaid. Don't quote me on that, but I know Medicare they're pretty big in, so that could be why, and I'm just speaking out loud. But the article referenced this, so I wanted to point out that there's some money shifting going on as well as these profits going up, right? While at the same time, the article pointed out that Dow was up 5.1% since January 3rd. S&P's up 18%, and NASDAQ's up 35%. So these big, huge carriers profiting more are down. And so I do think some things are going on in the marketplace. It's some muddy waters out there. Obviously, Wall Street demands more, so that I think that's what were the biggest things. So, but enrollments are going up too at the same time. So the average, I just pulled the highest, actually, the increase in the group market is 9%. And then in Centene insurance was up 50%. Centene's a big, huge company. They do a lot of Medicare and they do Obamacare plans. And that 50% bump is mostly in the Obamacare, partly because the affordable premiums, right? So they're in most markets, there are a lot of, well, I wouldn't say most, but they have HMO primarily and EPO, exclusive provider network, and they're just becoming a little bit more favorable in the marketplace, including even the tri-state county around Chicago. So out of those top profitable insurance companies, just to pull out some, you got, they work with these PBMs, and I'm going to connect them to the insurance companies, but Cigna, CVS, Aetna, and UHC are the dominant PBMs in the marketplace. They control 80% of the pharmacy benefit management space. And now they're actually trying to move and operate their own physician practices and clinics. So imagine if they could gain 80% control. They probably won't in that case, but they're going to control majority of it. And then all of a sudden now, Peter's paying Paul at a higher rate because they can, and then they're going to charge you for it anyways. And everything's an estimate. And maybe on the next podcast I'll record, there was a video that was put out by an organization that talked about that the rest of the world on consumer pricing had changed to an estimate, and then they bill you later for it, just like hospitals do and providers. And so you go to the grocery store, they can only give you an estimate of what milk is, and then they send you the bill after you consume the milk. And they could charge whatever they want. And the video references this. And I think it's comical, but there's truth and jest. And so I think that the hospitals and the providers know this as well. They're just going to say, well, that could be a price range of, $10,000 to $100,000. It's a big price range. And then you get the bill and it's really $130,000, right? Well, what changed, right? You gave us a price range, even though it was bogus to begin with. Now it's above that. Like, what happened, right? And they get away with it. And it's obviously wrong, but this video is referencing that. Just to point out more on the pharmacy benefit manager, Cigna now earns more from its pharmacy benefit manager, which is Express Scripts, than it does on its own health plans. CVS Health collects more money from Caremark, their pharmacy benefit manager, than it does on its own health plans. And half of UHC's profits, not even revenue, profits, are now coming from Optus division, which is their pharmacy benefit manager as well. Premiums will be going up and higher out-of-pocket expenses. It's really what it's going to come down to. And they have no incentive to actually control it because they're just going to pass the cost on. There's no limit anymore, right? And versus in the local market, especially when you have competition, if Mariano's and Kroger's is charging milk at $3, but if you go to another grocery store and they're charging $5, and this catches on over time, you have the right to actually shift, and it's transparency. You're a shopper. Well, you're not going to have that advantage, and they're just going to keep increasing the cost because they don't really care. And some of it's going to be paid for by insurance, and some of it's going to be by you, and more people are going to have medical debt. It's rising now, and it will continue to rise. Since most of the profits are coming from the pharmacy benefit manager and tax-funded programs, such as Medicare, Medicaid, and Medicare Advantage plans and the Obamacare plans, you will see an increase in the Obamacare plans, exchange plans, as well as Medicare Advantage and Medicaid plans. They're going to figure out ways to get more market share in those spaces. That's what's going to happen. And so Illinois wants to actually own their own exchange, make a public exchange available, which is not really good for policyholders. Some people think it is, but it's really going to underbid the rest of the market at some point. They just have to, right? If they complain, affordable healthcare is not there, well, they're just going to lower the price and make it affordable and eat the cost and then charge you for it in taxes. It's just the way it goes. They want more control of the cash, and between now and then, and most insurance companies are going to take advantage of this. And since it's through taxpayer dollars, they're going to reap more rewards because they're sharing the cost with the policyholder. So just more in recent data, there's been a slight decline since the Affordable Care Act and large groups self-funded. There's some speculation of this. Numbers are always fluid. It's hard to pinpoint exactly why this market was there. But my focus in this data was really to talk about the small and mid-sized market. The large market, I think they're testing waters to see if they can get out of something into something. In some cases, maybe fully insured was better fitting. It could be timing in the market. We're talking about just a 10-year snapshot. It's hard to say exactly what's going on there. And so meanwhile, the small and mid-sized companies are actually moving more towards self-funded plans. Why? Because they control the cost. So to refer back to the pharmacy benefit manager, just for one example, you have the ability to pick a more transparent pharmacy benefit manager. You could shop the pharmacy benefit manager and keep the same administrator, which could be Blue Cross or United or whoever, but usually you go to another third party, you control the administrative fee a little bit more. But you could keep all that and keep the insurance company how it is and switch the pharmacy benefit to control the cost. The loyalty for the big branded carriers are going to go away. So the big question is, do you want that 30% increase and just out of loyalty to keep that big blue card or green card or blue card, whatever it is? You want that, right? You're going to willing to be paying for a brand that doesn't have any loyalty in return. Or do you want to make it better and control the cost, right? So with the shopping the pharmacy benefit managers, you could create incentive to lower the cost of the medications. You could shop them. They could actually show you what their invoices are. They could show you what the true cost is and then how it's going to benefit the policyholders. Just a lot more numbers to deal with. You could eliminate more expensive drugs from the plan that have lower cost alternatives. There are a ton of lower cost alternative drugs, generic versions of it, made by the same company as the brand company without jeopardizing the employee's health. There's tons of these, and there's ways to walk through to make sure that you don't jeopardize your employees. But there's drug costs that could be in the thousands more versus the generic version being very affordable and even to pay cash. You could do cost analysis a lot more. Plan designs is one start, right? You could even do that in fully insured. Look at the plan design. We had one employer, they were 100 employees. We came in, they didn't want to switch carriers, so we end up just changing the plan designs, and we end up ultimately saving 25% across the board for this company in that first year. And so we stayed with the same company, right? There's no magic wand. It's all about math going in, math coming out. And so this isn't just increasing deductibles and out-of-pocket expenses. We actually did analysis on what was actually going to work for those employees and then figured out what would be a good incentive to move them to lower cost plans. In fact, we moved them to lower cost plans and their out-of-pocket went less. And so it's not like we jeopardized the employees, but they went to lower cost plans, which ultimately saved everybody, including the employees. You can incentivize the employees to go to higher quality facilities that really actually charge less versus more to help lower the cost to the employee, lower the cost expense to the self-funded program, but also you could lower or eliminate the employee's cost. Just imagine if you needed a transplant or you get diagnosed with cancer and you had some guidance to pick some of the highest rated facilities in the country. And possibly eliminate your employees out of pocket expenses to get there, right? Can you imagine that? You just get faced with this life-changing alternating medical condition, and then you just eliminate your employees out of pocket, and it didn't have that much of an impact on the bottom line. It's not as easy to do with smaller employer plans, but you could head in the right direction by making strides towards it. That's why it's a multi-year outlook, right? We're not going to change this thing overnight. And you can't just come and work with us for a couple of years and then switch back to a different broker or your older broker. This is a multi-year strategy, and it could keep changing depending on the size of the company, depending on what your employees need and your budget and where you want to go. You could educate the employees on ER visits versus urgent care. Right? And so a lot of people run the emergency rooms, and they should be going to urgent care to eliminate it. There's a business owner here in Chicago. He just put up public video on his Facebook just talking about he went to the ER and people were concerned about him. He's really good health, excellent health, hasn't drank alcohol in years, and he's fitness beyond anything else that I've ever known. And he wasn't feeling well, and his watch picked up that his heart rate was a little bit different. And so he went to urgent care first, and then they told him, you know what, you're going to the hospital because there's more tests we need that we can't do here, right? But all along he was under medical supervision, and I know even I could relate to that, where I woke up one morning and there was this sharp pain on the left side of my chest, and it would come and go throughout the entire day. So I said, you know what, it was in the mid-afternoon or something. I'm like, I'm just going to have a quick sandwich, and then because I might be there for hours. And I went to urgent care to help lower the cost. And the doctor actually joked that if there was anything wrong, we'll put you in the back of the ambulance and get you to the hospital as soon as we can. And so coincidentally for me, there was nothing wrong, but this other business owner I'm referring to, it was some type of irregular heartbeat. I don't know the exact details, but it ended up going away, and then it's treated with meds. And so I'm sure he's on the right track again, and he's been cycling and working out ever since and hasn't repeated the issue. You could educate employees on hospital charges versus the clinic for outpatient services such as lab works and MRIs, x-rays, because a lot of doctors will send them over to the hospital because it's convenient and all this other stuff, but doctors do it because there's an accountable revenue stream for each physician, but it's going to cost more. So if you find alternatives or places away from the hospital, it would be a lot less for the same results. Some doctors will pigeonhole you and say you have to go there. Those are the only results we'll look at, which is not true. Maybe some specialties, maybe that could be some truth to that, but most cases they could read any exam. And so, but they do it. In fact, there's a guy, he does videos. I think I'll put it in the show notes, but it's like healthcare AtoZ, and this is former physician that's working for the company and does education videos, and he actually just put out about most hospitals just talk about what the revenue value is for each physician. That's what they're mostly focused on, not outcomes. And so it's quite interesting where their focus is more on the revenue versus outcomes of patients. The other reason we move to self-funded plans is data-driven renewals. We've talked about this too, but knowing each category of the spending is kind of like line items on the P&L statement. So you're able to control things. You could use it for leverage against the same insurance company as well as the marketplace. We just did this for a renewal where we had the expense report and they had some claims, and it wasn't a good year, but it wasn't a bad year either. So we went back to the carrier and said, hey, there was a bone. These were the expenses. This is what they paid in. We actually talked numbers, right? Like, this was what the revenue they received on this account. This is what the expenses were. I don't know what the margins are. Can you please consider, and we actually threw out an offer of a decrease, and they actually approved it. I mean, it's not earth shattering, but it gave them, I don't know, it was like $3,000-$4,000 a year at least in premium savings. So it was worthwhile.